So, a majority of you have asked me to present on strategies for building attention in children. So, I put like 6 to 7 topics which I thought was vital based on the questions that parents frequently ask me. And attention span is what stood out, and I knew that parents wanted more help with attention span. But I also understand, and I want you to understand that attention span is one among the many things. It cannot happen alone. And now, for a child to have good attention and focus, we should set the foundation for them. Like, when you build a building, we don't go and start off directly with constructing a wall and a roof. What happens first is a foundation is dug, a foundation is set, and then the house stands on that foundation. If there is no foundation, that house or that building will not stand, it will collapse. It's the same thing for our kids. Building attention without setting the foundational skills for our kids will only cause it to collapse. Our children will not be able to sustain that attention. They will not be able to generalize that attention into different environments and different settings. Okay, which is why I'm going to start with the foundations of attention, and basically we're going to do the building blocks of attention. And once we complete it this week, the next month that I'm going to meet you for the next session, I will talk more about strategies for attention. So I'm going to cascade it one after the other in such a way that you are able to get it fully, and you know exactly what to do with your children when it comes to helping their attention improve. Okay, I have put attention span for a child based on their age here. So we'll start with till 7 years I've put here. For infants 0 to 12 months, they have brief moments of attention, usually only a few minutes or even a few seconds. And they are more responsive to sensory stimuli at that time. Which is why you see when an infant is born, a newborn baby, we rock them, right? That is vestibular input. We cuddle them, we hug them. All of that is proprioception. It's tactile, right? We sing to them. And how do we talk to a child, a newborn infant? Not a child, sorry, a newborn infant. Do we say, come here, sit down, give me the book, take the pen, take the flashcard? We don't talk like that. But how do we talk? Hi, baby. Mama loves you. What a cute baby you are. This is how we talk. Now, that speech is called motherese. Okay. And we talk very softly to a newborn infant. And as they grow older, we may sound a little more louder, a little more faster. But for a newborn, we talk very softly. Likewise, in order for our young children who don't have any attention, even for a minute, how should our speech be? That is an auditory input, right? And girls are more sensitive to auditory input than boys. And for boys, it's more to do with visual, touch, and tactile. It's not that girls don't need it, but I'm just saying that, as the gender, there are a few variations, and we need to be sensitive to that as well. And while we talk about the newborn or the infant's attention, I want you to associate it with our children who don't have adequate attention as yet. So be careful how you talk to them. Don't alert them. Don't yell at them, or don't reprimand them more than you should, because it can be overwhelming for the child. Be gentle, be soft, be slow spoken. Okay. Secondly, use a lot of touch, hugs, and cuddles. Use a lot of compressions. You see, they wrap the baby, after a bath, and they just lay the baby to sleep, and the baby so cozily sleeps. Our children need those kind of tight hugs, and sometimes maybe even wrapped in a blanket if they're comfortable and they feel safe about it. And we put the newborn baby in a cradle, right? That's vestibular input. Likewise, we can have cradles, or we can have movement that you see in the OT session to help the child get that sensory input to calm them down. Okay, so this is the adequate age and the adequate amount of attention span for 0 to 12 months. When we start with our kids, we're going to start here if they don't have any attention. For toddler level, 1 to 3 years of age, their attention spans range for about 3 to 5 minutes. They are easily distracted but can focus on activities they enjoy. For preschoolers, their attention span age range is 3 to 5 years. Attention span extends to about 5 to 10 minutes. They're still easily distracted but can engage in simple, structured activities. Early school age children, the attention is 6 to 7 years. The age range is 6 to 7 years, and their attention span ranges from 10 to 15 minutes. Children can focus on more complex tasks and follow simple instructions. You see, only by 6 to 7 years of age, it's typical for a child to have an attention span of 10 to 15 minutes, not earlier than that. Okay. But if we insist that the child has to sit for 40 minutes, some children sit for 40 minutes and they keep doing stuff, but you see, we keep changing their activities. We don't insist that they sit, which is why we don't use chairs that are locking children, because we want to give the child autonomy. If they want to get up, they should be able to say that or move. Because what we think is easy can be overwhelming for our children, which is why they get up and they move. So we have to either change the activity or change the way we work things or give a sensory input to help them to calm down. Now we're going to see what happens when children are forced to sit and attend for prolonged periods of time. One, there is excess stress hormones that are released in their brain. The cortisols are discharged at a much higher level than they should. And this can lead to increased dysregulation after the period of sitting or after an attending task is given to the child. Okay. When I say dysregulation, the child can be movement seeking after that. They can jump around, they can get angry, they can get irritated, they can get annoyed. And you'll be wondering, this guy was sitting so well for this long, and all of a sudden, why is he behaving like this? That's because he was made to sit forcefully for a prolonged period of time or made to attend forcefully for a prolonged period of time, which has caused that dysregulation, anxiety, and restlessness in the child because of excess discharge of the cortisols. Okay. Now, does this happen only in a certain environment? Not necessarily. If the child was forced to sit in, say, for example, a therapy environment, you will see that dysregulation will happen even at home. You will see that dysregulation happen elsewhere. Or if the child has put a lot of barriers around in his school environment, and the child is restrained from doing things because he has to sit and focus and pay attention, what happens to the child when they come home? They're dysregulated. They probably are throwing a tantrum or they melt down. They scream, they cry. It's not because they just want to throw a behavior and get with their way. That's not the intention or the reason. It's because they were overwhelmed and they're not able to manage what's happening inside their brains and how they can refocus and feel more composed within themselves. That's why we see that dysregulation happen. It can also lead to children disliking sitting and attending to anything altogether. You'll be wondering, my child was doing well when he was around 3 years of age, and now he's 3.2 and he doesn't want to do anything he did before. So, you know that at 3 months, say for example, you know that in June the child did it well, but since the month of August, you're seeing a difference. So, you know that something has happened between June to August. Go back and troubleshoot. Find out what has happened. Discuss it with your clinician. Discuss it with your spouse, your family, and understand what could have gone wrong. Be transparent in your communication with your clinicians. And that will help you to find what the problem was, troubleshoot, and refocus to get back where we started. Okay? That's for children who already had sitting and attention and now they are dysregulated. This will also lead to a lot of behavioral challenges if we keep forcing children to do. I recently had one of her parents tell, "Ma'am, you have to force her to do things, then only she will do. Don't be nice to her." It's not that way. So then I was able to explain to the parent why we need to give children a choice and why we don't enforce things on our kids. Okay, it can lead to behavioral issues. So you'll be wondering why my child doesn't talk, although my child can talk. Because a child is talking based on a demand that's put on them, and they've not seen talking as a joy of communication. I had recently a new consultation who came into Dimensions, and I was connecting with a parent in my consultation sessions, and she said he has a lot of he was taking ABA, and there it is all based on rewards, right? You sit for 20 minutes, you get reward. You talk, you get a reward. You use a sentence, you get a reward, and most of the rewards are tangible or a book reading. And the reward is given only for a few seconds and taken away if it's a book reading. What happens? The child will lose interest in book reading. Um, so these things can prevent the child from paying attention and focus. So likewise, this child who I spoke about, who was talking in sentences in the therapy session, doesn't talk or doesn't even request or doesn't even answer questions consistently because there's no reward. The child is so attuned to talk only when there is a reward. Why will the child talk when there is no reward? You get what I'm saying? So give the child the autonomy, the choice to talk, to communicate, to enjoy that interaction. Now, you and I love to talk, right? We love to meet our friends, talk, connect. And if our children need to do that, they should be extremely happy from within. Okay. If not, it will lead to behavioral issues. If not, it can lead to tantrums. Maybe in that environment where they're taught to do something, they will do it. But beyond that, they may not be able to do it. Okay. So be cautious of that. It can also lead to resentment and resistance to people, places, and learning for our children. So it's that serious. And we don't want our children to resent people or, dislike connecting with people or go to certain places or, dislike the learning process altogether. So be cautious that we don't force our kids to attend to certain tasks that we give for our kids. So if our kids need to pay attention, what do we need to do? We need to help our children process their senses adequately, help them to feel regulated, help them to feel connected with you so that they can engage. Then we work on their joint engagement and then joint attention. And then it's attending to tasks and activities. If we use this hierarchy from top to bottom, we will be able to give our children a safe zone where they would love to pay attention to things, where they will grow with paying attention. Okay. I have this pictorial representation for you. This is the last slide. After this, we are done. I've put this pictorial representation to help you understand how certain aspects of these foundations we are talking about are interlinked and connected. First is sensory processing and regulation. Let me explain this to you. Sensory processing is how we make use of our senses, our vision, our hearing, our touch, our movement, our deep compressions at the joints, and how we feel our body move, even without seeing them, we know it, and how we feel taste and smells. All of this is our senses, and how we process them is to do with how we take input from our environment and how we respond to our environment. And during this course of time of taking information from the environment and responding with our senses, we feel a sense of calm and we are able to comprehend what's going around. And that's sensory processing and regulation. That's when you feel regulated. Now, you feel a sudden shrill noise in your environment. You feel annoyed, right? You feel dysregulated. But you have a calm, soothing music. You feel that calmness in you. You feel more composed. You feel like reading something, or you feel like just relaxing and listening to that music. So that's regulation through the auditory system. That's just one example I'm giving you. Likewise, it holds good for all the senses, with which our OT will be working on, which our speech pathologists will be working on, because they know that that's the foundation to attention and focus for our kids. Okay. And then comes the sense of relatedness. I'm sure I spoke about this last time when we met about the sense of relatedness. So when a newborn infant comes into this world, they don't start coming, hey mama, hey papa, hi, how are you? They don't come that way. How do they come? They come looking at you. They come with a smile. They come with making gurgles and noises of pleasure. They come with getting angry and they're hungry and they scream and they shout. That's how infants communicate themselves, right? And that's the sense of relatedness that they have. That is the first bunch: the smiling, the cooing, the looking at the parent, and trying to reach out to the parent. All of that is a sense of relatedness. And that's what first develops, not speech. So if speech has to develop, the child has to be regulated. They have to be able to make sense of their senses. They should feel related to the person who's with them, the parent or the clinician. And then they will be able to attend to them. And when we talk about attention, it is to do with joint engagement first. Joint engagement is that connection I said, that the caregiver looks at the infant looks at the caregiver smiles and talks to the infant smiles. That's joint engagement. They both are connecting with each other, okay? And joint attention is as the infant grows older, and the parent shows something and say, hey, look, I have a beautiful cup here. Do you want some milk? And the infant looking at that cup, what the parent is showing is joint attention. Basically, the infant and the parent together are paying attention to an object, or they're paying attention to an activity or a person, or they are paying attention to something that is outside there. That is joint attention. Okay. Now, these three are important for our child to start speaking and learning language. I wanted to implement what I shared here about how an infant learns to pay attention. What is the process? Sensory processing and regulation, relatedness, and attention. They are interconnected. You can't separate them and say, I tried to actually put it as a hierarchy, it doesn't happen. So they're interlinked, interlocked, interconnected, and they work together to build the attention in our child. So that is what I want to share with you as a part of building blocks of attention for our children. Once you've understood the building blocks of attention, in the next session that we have, we will discuss more about how to get the child to attend to activities. We will speak more about the pre-linguistic skills that a child needs to learn language. That will help you to gauge attention more better from an in-depth perspective rather than just from the superficial part of it. So I want to take you through from deep within and give you a strong foundation, and gradually we progress on it. Okay, so this week your focus is going to be on building connection, relatedness, sensory processing, and regulation with your child. Your relatedness, when I say how the child feels connected to you, how safe child feels with you, and also your joint engagement, like you both are going to attend to each other. You can play social skill games like peekaboo, hide and seek, tickling, those kind of games where there's no object, toy, or tool. You can create a tent in your house with old dupattas or blankets and put a small mat inside that tent and stay inside cozy with your child. They would love it. So build that engagement and connection and zero down the screens. If you do this, you will definitely see a good progress. I'm not saying that no screens at all. You can use screens maybe 15 minutes a day. That's enough, because for some of our kids, what they're watching matters, and the way their brain functions and attunes to screen matters. With some children it's okay, but some of them get easily dysregulated, and you know your child, and you know if 15 minutes is good enough or no screen is good enough. You take a call on that.